First, I would like to thank you for the invitation, and thank you, Veronica. Congratulations for this very important event. I also would like to thank you, Denis, and I think it's a very important opportunity to share the Brazilian experience on affordable medicines in the context of the health system development in Brazil. Over the last 30 years, we're gonna, in 2018, we are celebrating the 30 years of the Brazilian health system reform. And over this period of time, we have a lot of achievements, but also challenges in a perspective of country and developing country. And also, we are passing over an important crisis in the perspective of democracy, economic, and certainly it will have effects on the health system and also on access to medicines. And I would like to talk about this in this event. So, Brazil, the first important issue for provide medicines in a country the size of Brazil, with 200 million people, with a lot of differences. In this country, we have 5 regions with a lot of differences, 27 states, more than 5,000 municipalities, 70% of municipalities with less than 20,000 inhabitants. In this country, we have a universal health system. Since the Constitution of 1988 defined health as a right of all citizens. So it's one of the first countries that define health as a right and a state duty. And so this is the basis that we are talking about, access for medicines, affordable medicines. But developing this health system in a very unequal country, despite of the progress that we developed over the last years, we're still a very unequal country with a lot of poor regions. And if we observe these 30 years, we cross different phases. So during the 90s, we make a lot of effort to control inflation, and we have influences of neoliberal policies. From 2003 until 2014, we have an amazing period of economic development and social development too. We take from poverty more than 36 million people, the size of an Argentina. This is an important achievement of that Brazil did. So the reduction of extreme poverty was 64%, and in 2014 we came out of the hunger map. But nowadays we are crossing one of the most important economic and political crises, and we are under the influence of austerity policies that we're going to talk about. So the health system development influenced the pharmaceutical market. Veronica introduced some important issues about Latin American perspective and also about the Brazilian data. So despite the crisis, we are increasing pharmaceutical perspective. We came from the 10th position in 2011, and we are in 2016 in the 8th position, and the perspective for 2021 is kind of the 5th position. So the industry have a revenue about $25 billion, 146 billion doses, and divided in 61% of similars, 21 references, 18% of generics. We also have an important issue that Veronica introduced, the trade balance. We export $1 billion of reais, import around 6 billion, and our trade deficit. This is an important topic that I will talk about in a perspective of how the health system development could be related with a policy for the industry. So how we could connect the health system with the industrial policies. And here we have one of the most important thinkers in Brazil, Carlos Gadelha from Fiocruz, that one of the leaders of the thinking and how we could connect the health system development with industrial policy. So I think the basis of the Brazil development is the health system and in a perspective of the pharmaceutical policies. So Brazil, since the 90s, implemented the unified health system with principle of universality, comprehensiveness, so we have a broad services that are provided for people, equity, and guidelines of decentralization, regionalization, hierarchical organization, and social participation in all levels of the health system. In all levels we have community participation, health councils, and it's municipal level, state level, and federal level. The health expenditure increased from 2000 to 2014, data that we have from the World Bank, from 7% of GDP to 8.4 or 8.3% of GDP. The per capita expenditure increased too, but not enough. But I think one of the most important problems is the share of the expenditure in public and private. So I talked about the public, but we have a huge private sector in Brazil also that work. It should work as a complementary, as a supplementary, but work more in a competitive perspective for the resources. So the private sector cover around 25% of people in Brazil and use 54% of the resources. So this is one important issue that we need to discuss in a perspective of how we're going to sustain a perspective of access, universal access for medicines. And the model of care, I think, is important. Also highlight that the implementation of the public health system in Brazil changed the model of care. Until the 80s, we have a hospital-centric model, and after the 90s, we start to implement a primary care model with the family health strategy. And we cover until in 2016 around 60% of people, so 120 million people is covered in the country with some variations. In some regions, the poorest regions, it's around 80% of coverage of primary care. And the utilization, 70% of people use only the public sector and 25% use the public. So this is the base of the health system where the pharmaceutical policies were implemented. So we have a timeline that's very interesting to observe, that we were one of the first countries to implement free access to HIV medication, and in the perspective of having a strong policy for HIV care in Brazil. So the access of drugs was a consequence of this policy. After that, we implemented in 1980 a national list for essential medicines. Then a generic drugs policy in 1999, a popular pharmaceutical policy. The focus were on the people that have private plans, but the private plans in Brazil doesn't cover medicine. So this program was to these people, and this is one of the regions that out-of-pocket expenditure is important in Brazil. In 1907, we defined funds for and responsibilities for pharmaceutical care in SUS, and in 2011, Carlos Gadelha implemented a very interesting program that is the free of charge drugs in Farmácia Popular for hypertension, diabetes, and asthma. But these pharmaceutical policies were connected with regulatory actions. So in 2000, we implemented the Brazilian Health Regulatory Agency. So we have around 18 years of experience. We are in the majority now of this, but other majority, more a teenager than a majority because of the credit we're crossing over. And inside Anvisa, we implemented a chamber to regulate the medicines market with the definition of prices, and I will talk about this. Also, with these regulation policies, we implemented a policy for incorporation new technologies in the health system. So in 2006, we implemented a commission for technological incorporation. In 2011, it changed for a national commission for technology development. So the health system only can provide the drugs that are authorized by this commission. And the health system development also developed the capacity to think about in a health industrial complex, to use the capacity of the government of purchase to foster the industrial complex, and this started in 2008. So it's interesting to observe that it's a timeline of rational developing of the health system, regulatory actions, incorporation of technologies, and fostering industrial complex. And in this industrial complex, we had talking about innovation and other issues. Brazil, over this period, increased a lot the number of products provided for the people, who came from 300,000 products to close to 900 products. And Conitec was very important to support the definition of inclusion, exclusion, and approve guidelines to use the drugs. The SUS is divided in responsibilities between municipalities. So the municipalities are in charge of many issues about providing healthcare and also providing medicines on basic medicines for primary care, for hypertension, diabetes. And we have a strategic component of the pharmaceutical products for endemic disease and for target programs that it's under the responsibility of the Ministry of Health. We purchase, the Minister purchase the drugs and transfer to the municipalities and states that provide for the people. So the basic one, the municipalities purchase. This can be one of the reasons that we have high cost of basic medicines. The other ones are purchased centralized by the federal government. And also it happens, it's centralized with the specialized component. It's a high cost treatment for chronic drugs and heart disease. Finally, we implemented, are drugs provided by the public system in public units all over the country. And since 2004, we start a very interesting public and private partnership to provide drugs in private drugstores. That's the Popular Pharmacy Program, Farmácia Popular. The initial focus, as I said, is in to user of private plans. Since 2004, it started with public pharmacies and then changed it, as I said, to partnership with private drugstores in 2006. And since, so this is a subsidized cost for contraceptives, dyslipidemia, and since 2011, we start free of charge medicines for hypertension, diabetes, and asthma. And this make a very important impact on hospitalizations and mortality that I'm going to share in the following presentations. But so the first one is a perspective of how we're going to provide drugs for people in basic, strategic, and specialized, and develop partnership with the public sector in a perspective that we have a mix of health system with public and private. Now I'm going to talk about the regulation of technologies. So Anvisa is they're responsible for sanitary control of production, marketing, and use of products and services in a broad perspective. But there is a special area of Anvisa, that's CEMED, that's Chamber of Medicine Market Regulation. It was implemented, as I said, in 2003, and after 2003, it stabilized the market. If you're going to observe the increase of cost in this first graph of the cost of medicines compared by inflation, from 90s until 2000, there's a high increase in the costs. And after the implementation of this chamber, we stabilize the prices. And it's done by annual price adjustment for drugs price selling in the private sector, and also defining cap price for new drugs. And this cap price is, the methodology is to compare with other countries, so not define a cap price higher than the lowest price found in the other countries, and also if a new drug, a comparison of other existing therapies. If we compare with the inflation over 2000, from 2005 to 2016, we could observe that the inflation was around 100% of inflation, and for drugs it was 77% in average. So it was lower, and it was important for make more affordable prices. Also, this experience that I think is very interesting to share with you is the industrial policy that was developed since 2008. Brazil have a strong external technology dependency and access new technologies, so we need to import a lot. But we have the government power to purchase health supplies. So with this combination of need and power to influence, and we developed the PDPs as a partnership for productive development. It's a partner of public and private laboratories to transfer and absorb health technology for production, medicine, and vaccines. So we purchase the drug, and also we purchase the technology in a combination with public and private laboratories. We have 26 public laboratories in the country. The most important is in Fiocruz. And we could observe that for high-cost therapies, there are 91 projects in effect. Anvisa already registered 33 products, and the Minister of Health is purchasing 27 products. So we could observe that there is a decrease in the prices of the high-cost therapies. And if you compare PDP products with non-PDP products, the PDP products decrease. Have a higher decrease on prices. So this is a strategy to have more affordable prices for high-cost therapies. And we could observe that the access for drugs is increasing in Brazil for chronic disease. The national surveys show that around 80% of people can access the prescribed drug. And the prescribed drug, 70% of people that is using this drug is under the national relation of medicines. And this 77% from these drugs, around 70% are obtained free of charge. And they can obtain free of charge this is in Portuguese, I'm sorry, but it's around 22% in the public system, in the public pharmacies. 21% in the Farmácia popular pharmacy, and 30% in private pharmacies out of the Farmácia Popular, and around 18% in also from public and private. So if we sum these sources in public, around 65% of people access drugs for treatment of chronic disease in this mix of public and private system. And this is one study that was recently published last year that show after the introduction of the free of charge access to drugs for hypertension, diabetes, and asthma in Brazil, in Farmácia Popular, after 2011, the access increased a lot, and so in the first graphic, and it had an important impact on decreased hospitalization and decreased mortality. So the estimated benefit from our deaths and hospital admissions represents around 60 times of total amount of federal reimbursement over the period of the analysis project. So this is important impact of we need to invest this to have a return. But we have so these are the achievements. We have important challenges. If until 2014, if everything was going in a good perspective, we had important challenges for sustain this health system in a perspective that to increase the percentage of health expenditure with medicines, despite of the different strategies. So the Ministry of Health budget with medicines increased from around 11% to 16%, so it's 5% in the budget of the Ministry of Health is very important. So we need to take from primary care, hospitals, from other areas to support this. And if we observe why it's increasing, the most important part is because of products in the specialized and strategic areas, so as a high-cost medicines. Also, we have an important impact to sustain the Brazilian health system with the public expenditure. The Brazilian, despite having a universal health system for 30 years, we didn't have a fiscal space to sustain. So this is an important issue to discuss with our friends from the from the World Bank that is defending universal health coverage. How are we gonna build a universal health coverage without a fiscal space? And we need to pay at least 50% of our budget to pay taxes for refinancing the public debt or to pay the debt. So this the percentage of the budget that goes from health is around 4% of our budget. It's a country that works to pay debts, and not only Brazil. I think this is a issue for developing countries. Also, despite develop a universal health system for everybody, despite of developing strategy to regulate which drug should be provided for the people. So we are providing, as I said, around 900 drugs. We still have an important problem that's increasing a lot in the region. It's not only in Brazil, but it is in developing countries, of judicial decisions that make a mandatory expenditure to buy high-cost drugs that even are not registered in the country. So from 2006 to 2016, it's explosive expenditure. So in 2017, the country expended 1.3 billion of reais. It's 1.2% of the Ministry of Health budget that it's not defined in the beginning of the year that you're gonna have this expenditure, because it's a mandatory expenditure that. So this is an important problem, and we spend it with 15 drugs, almost to genetic diseases, cancer, and so this is an important issue for Brazil. And so these are challenges that we are having in a perspective of sustainability of our health system. And nowadays we are crossing an important crisis, and we have a new fiscal regime that is very hard to explain how a country make a decision to freeze the public expenditures for the next 20 years. It's not for 1 or 2, it's 20 years. Everybody goes, what? 20 years, yeah. This current government approved a constitutional amendment that the expenditures should only can be corrected by the inflation. So even if the GDP increase, you can increase public expenditures. But we can pay more debts. This is not a problem. This is only for public expenditure. So this certainly going to affect the health system development. It's impossible to have a universal health cover, universal health system with this tax regime. So this is one thing that is under discussion in Brazil. The former minister from this government said that we need to review the SUS normatives. The health system for all is a dream, and who advocates this are ideologists, not technicians. And there are implemented a lot of political deregulation. So the financial blocks for primary care, for surveillance, pharmaceutical assistance doesn't exist anymore, so you don't have more target funds for these blocks. And these target funds were the pillars for primary care and pharmaceutical assistance development. So finally, if we're going to observe this Brazil case on achievements, challenges, and threats, it's possible to observe that the connection of universal health system, regulation of prices, and industrial policy make a good combination. That we could invest in primary care, free access to medicines, and affordable prices. Improve access to health care and improve access to medicines in a combination. And we have, as a result, the reduction of hospitalization and improve on health outcomes. But the challenges from a health system in the perspective of Brazil is that we didn't develop a fiscal space for financing this health system, high cost of new drugs, and suboptimal allocation of health resources, including medicines. And the threats, we are, in our democracies in fact, we have the influence of long-term austerity policies and the regulation of public policies for social protection. So, as Cesar Vitor, a very close friend that is teaching some courses here at Harvard Public Health School, said, ultimately the change is political, required to the continued engagement of Brazilian society as a whole to ensure the right to health for all Brazilians. And Tom Jobim said, I think, Brazil is a complex country, not for beginners.